tell you recently, I've seen a couple of cases of hand, foot, mouth come
Okay.
in, and when we started talking about this, I went, "Oh, that's a great one for this," because this is about the time we start seeing this, kind of into the spring, into the summer season. We start seeing these kids who maybe have a little bit of a runny nose for a day or two, some fever, maybe a little bit of sore throat, and then they start getting this rash on their hands and feet, often on the palms and soles that kind of moves up the arms and legs sometimes. And families come in and they say, "What is this?" And I go, "That's there it is. It's the hand, foot, mouth."
It kinda has some, gravity to it. I don't know if it's the name, if it just creates a lot of, I mean, it admittedly, it can be a very miserable illness for kids. But so you alluded to the fact that it's, more common in spring and summer. Any other highlights about it, whether the ages? You talked about the presentation
Yeah, a
generally.
lot of times it's really it can show up in anybody. By far the most common are gonna be these preschool age kids around that age, and a lot of that is probably has to do with how it's spread, which is through, like, through saliva droplets, also through stool, through and in kids at that age, they're touching everything and they're not washing their hands great, and so it's easy for it to spread through situations, through those, through daycares and school settings and things like that. I think the other big thing that comes up with it is and you're right, it's got a lot of gravity and like, parents are always say, "Oh, no, not hand, foot, mouth." You go, "Well, actually, you know what? It's kind of a rite of passage for kids because most kids are going to get it at some point in their life, and typically it's just maybe a little bit of a miserable experience, but it's a viral infection more often than not. Their little immune systems will fight it off without problems. And as long as they are comfortable and they're not getting to a point where their throats hurt bad enough because the lesions potentially in the back of their throat, that they're not hurting bad enough that they can stay hydrated during that time, you say, all right, just wait it out. Time, the tincture of time will fix this and your immune system will get this. We just got to make sure you're comfortable in the
So
meantime.